Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Because when it comes to COVID, the fear is that what happens in Brazil won't stay in Brazil. The new variants from the world's new pandemic hotspot are not just much more infectious, possibly vaccine resistant, but also killing much younger victims.
He played down the threat of COVID-19, refused to be strict about preventing its spread. Now Brazil's President Jair Bolsonaro is being blamed for his country's deadliest episode of the pandemic yet, with a highly transmissible variant and warnings from doctors reporting more young people being admitted to hospitals with the virus than ever before. Deaths from COVID have soared in Brazil, hitting a new peak in the last few days. Our international editor, Lindsay Hilson, reports now on the first wave from Sao Paulo last year. Now she looks at what the city is facing in the latest outbreak and what it might mean for the rest of the world.
Every bed contains a patient struggling with COVID-19, and almost every ICU in Brazil is full to capacity or over. Individual struggles adding up to a nationwide catastrophe that potentially threatens the world. Here in Brazil, the coronavirus hasn't yet reached its peak. I visited the San Andrés Field Hospital in Sao Paulo during Brazil's first wave last year. It's in a volleyball stadium, and they said it was temporary. But to the despair of Dr. José Roberto Marçontente, it's proved anything but.
Em relação ao ano passado, a gente nota que os pacientes eles estão evoluindo de uma forma mais rápida. A idade média de internação abaixou de 10 a 20 anos. Antes a nossa idade média era alguma coisa entre 60 a 70 anos, né? E hoje em dia isso abaixou para 45, 40 anos, 55 anos.
The P1 variant, first identified in the Amazon city of Manaus, is now the dominant strain across Brazil.
Com certeza houve uma mudança na agressividade do vírus e também na prevalência da doença. Ela está transmitindo mais, está acometendo pacientes mais jovens, está causando mais óbitos, está causando mais quadros de insuficiência respiratória com necessidade de intubação.
Tudo bem, mãe? Tudo bem, pai?
38-year-old Wesley da Silva Marcelino is recovering and able to speak to his family.
Falta pouco, graças a Deus. A gente venceu essa guerra aí.
He's shedding tears of joy and relief. He can't wait to hug his children.
Saudade. Duro. Você pode ter a chance de nunca mais ver eles. Você tem a chance de você nunca mais ver. Muito triste. E o pessoal não acredita, né? Só quem passa aqui realmente mesmo que vê que é grave. Abriu o olho dela.
But tears of grief are increasingly common.
Era meu filho, e eles não sabem quanto meu filho era tudo para mim. E por isso eu me revolto com isso. É muito descalço aqui nesse Brasil. Sabe quando é que eles enxergam a gente simples, humilde? É na hora que precisa de um voto.
Brunan Cardoso was only 22. Here he is, inviting friends and family to a barbecue. He holds the unbearable distinction of being the first person in Sao Paulo to die because he couldn't get a bed in ICU. He was allocated one 19 minutes after he died.
Da formatura dele de escola. Esse é a nossa vida. Essa é a nossa razão de viver. Levantar dia após dia.
Queuing up for vaccination, but only 8% of Brazilians have had the jab. because the government failed to procure enough. Epidemiologists say that widespread vaccination is the only way to get ahead of new variants. But hesitancy is rife, in part because President Bolsonaro joked that those who'd been vaccinated might turn into crocodiles. The queues for the soup kitchen are even longer. Bolsonaro refused to order a nationwide lockdown because he said he wanted to protect the economy. But his policies have protected Brazilians from neither poverty nor the virus.
Aqui em casa está todo mundo desempregado, é a minha sogra que me ajuda e ela também trabalha de faxineira. E esses dias está fraco as faxineiras por causa da pandemia, não é, todo mundo está chamando ela todos os dias. E eu vim para cá para pegar comida todo dia.
In the city's main cemetery, they're exhuming the dead to make way for more. The P1 variant of COVID-19 is ravaging Brazil. It's already spread beyond the borders. And if the Brazilian government doesn't act now, more variants could yet emerge.
Lindsay Hilson there with that report. And I'm joined now from Sao Paulo by a professor of neurobiology, Dr. Miguel Nicoleles. Dr. Nicoleles, you're looking at the graph of this disease. It's terrifying. It shoots right up against everything that's gone before. How serious is this for Brazil?
Well, this is the largest humanitarian tragedy in Brazilian history. We have never seen anything quite like that. As you said, in the second wave, we have a nationwide hospital collapse. We have a pandemic that is completely out of control. We have new variants showing up in different parts of the country. And just today, the state of São Paulo has released, again, a new record of 1,389 deaths in the state, which is, something nobody ever thought could be reached. Just to give an idea, 3 weeks ago, we had half of this number of deaths in the state of São Paulo. So it's a cataclysmic event in Brazilian history.
This is a new variant, and you mentioned other new variants in Brazil. How much of a threat to Latin America is it? How much of a threat to the rest of the world?
Oh, I think this is a gigantic threat to South American, Latin American, and the world as a whole, because the variants have spread very widely throughout Brazil, and we share borders with 8 countries in South America, and these borders are very porous. So I have no doubt that the variant is spreading, as it has already been detected in Uruguay, in Bolivia, in Paraguay. So we heard about outbreaks in Canada, in Japan, in Australia. So there are 36 countries that have confirmed the P1 variant already. So any variant that shows up in Brazil is likely to spread through the continent in a few days, and in a few weeks could spread to the whole world.
I worry about asking you this as you're sitting in Sao Paulo, but how far is President Bolsonaro responsible for the way in which this whole business has been tackled?
Well, certainly he's the most responsible person for the cataclysmic event that we are living through. He denied the relevance of the crisis. He didn't take the right measures from the beginning. He mocked the efforts to get vaccination going on across the nation. He didn't allow his ministers of health, and he has gone through far by now, to do what had to be done. So in simple terms, he is the public enemy #1 of the coronavirus fight in Brazil, and I dare say he's public enemy #1 in the entire world, because no other government, no other president has done so much to undermine the efforts of the scientific and medical community to tackle this tragedy here in Brazil and around the world.
And can I ask a very brief question? Should the World Health Organization intervene now?
Oh, I think so. I think the World Health Organization should help Brazil procure enough vaccines. Brazil can purchase these vaccines, can purchase millions of doses right now. So I think this is a global threat. This is a global problem. And the international community should help Brazil to get out of this, because until the pandemic is controlled down here, it is not going to be controlled around the world.
Dr. Nicolelis, thank you very much indeed for talking with us. Thank you.